வேதான் சேனல்.
வாழ்க வையகம் வாழ்க வையகம் வாழ்க வளமுடன். குரு வாழ்க, குருவே துணை. Today we are going to see about the transformative midwifery education for relationship based and transformative midwifery practice in India. Transformative midwifery educations. Transformative midwifery education means though students are studying about that midwifery during the time of 4th year. In that time they are going to study about the midwifery. Means the midwifery is those are giving care to the period of the mother. It's having antenatal, intranatal and postnatal period. So during this time, the which persons are giving care to the patients, that person is called that midwifery. So in the midwifery educations they are going to study in that 4th year BC nursing. At the same time, midwifery in separate course also will be available. That is a nurse practitioners midwifery also will be available now these courses. So this course, transformative midwifery educations for relationship based and transformative midwifery practice. How they are going to study that midwifery educations, based on this only that transformative midwifery practice also will be occurring in clinical settings. So that how it they be practicing in India, that like that we can able to see in this topic. First we'll see the introduction. In this introduction, midwifery is the study of midwife. Midwife means who is giving care to the mother during, before and after the period of pregnancy. Midwifery means is the study of midwife. Means that this is a study. Those who are going to study about the midwife, what they are going to do. Midwife means what they are going to do. Midwife means who is giving care to the mother during time of pregnancy, and next during time of the delivery and after the delivery. In these times, the who's giving care to the mother, that person is called midwife. And midwifery educations program carried out by the various organizations for the purpose of improve the health for the antenatal, intranatal, postnatal and newborn baby. Midwifery educations program will be carried out by the various institutions and organizations. Why means because of in India also, in India the mainly focus will be various committees and various yojanas will be given, the focusing to that adult health and mother health and as well as to the newborn health for prevent the illness of the mother and newborn baby. Like that will be present for this purpose to improve the health of for that antenatal, intranatal, postnatal and newborn baby. For this purpose only midwifery education program will be available. In India, various schemes and committees are made to prevent that maternal mortality, morbidity, but still is going on. What still is going on means maternal mortality and morbidity also will be having still. If so, in this committee, in this schemes and committees and all will be having that they are thinking that they want to improve the health of the mothers as well as to the baby, but still that maternal mortality and morbidity will be having in India. In Government of India, Ministry of Women and Child Development and develop various schemes. Now we'll see that what all the schemes will be available to improve the mother as well as to the fetal health, to provide the fetal health as well as to the newborn health. If you see that schemes, examples I gave here, 3 of them. Child Protection Service Scheme, it started in the 2009 to 10. Mahila Shakti Kendra, it started in November 2017. And Oceans Abhiyan, it started in that 8th March 2018, etc. Most of that committees and schemes also will available to improve the health of the mother as well as to the baby. According to the last census, means 2021, and that durations, that maternal mortality ratios will be having that 130 to 97 per and 1 lakh live births, that will be having 2014 to 2016 and 2018 to 2020 of census. 7 percentage of death women occur in that 15 to 29 years age because of this woman's maybe that early marriage, maybe that the mother will not take proper treatment and their mother will not having proper awareness of this. So these are all the reason maybe occur. And every 1 lakh live birth in 2020, 97 women died of maternal causes. See, if you're seeing that in live birth is having every 1 lakh live births in 2020, 97 women death of maternal causes. Because of maternal causes, 97 women will be death will be occur during the time of 2020. It's a 1 lakh live births. Next, we will see that maternal mortality morbidity rate. That is maternal morbidity ratio. That is 810 women died every day in 2017 due to complication of pregnancy and childbirth. And 20 or 30 women suffering from maternal morbidity. This all is coming in that last census of India. And next, infant mortality. Infant mortality is 2.25.799 death per thousand live births. Here 3.08 percentage decline from 2023. And next we'll see that midwifery practice in India. So in India, midwifery practice, what and all will be having, that we'll see in this topic. Midwifery aim is to improve the mother health, newborn health, and also to provide the quality of care during perinatal period. Then they focus to maintain the normal childbirth. Midwifery, its main health, if you're seeing means, that is the mother and the midwife is she has to focusing giving care to the mother, newborn, as well as during time of the perinatal period. So they will focus only for maintaining the normal childbirth. If you're seeing the concept will be having that um, 6 main concept will be the first one is to promote perinatal mother health, and second one is safe midwifery care, and third one is promote self determination, and next respect the mother and their culture, and fifth one is educated practitioner, and last one is the role of midwife. This 6 concept we'll see in this topic now. First we'll see that promote health to the mother and newborn baby. This is the first one of the concept. Here in the first thing, provide proper vaccine to antenatal mother, maintain antenatal care clinic, means that antenatal visit we have to maintain. How many visits are coming to the antenatal mother, that we have to maintain, and each and every visit we have to advise mother to come for the clinic if suppose they are having any abnormalities, means we have to instruct to the mother to come to the hospital settings to take the treatment for this abnormalities. An intervention of mother during intranatal should be carried on the time. If suppose the mother is coming for that intranatal period to the hospitals, proper assessment must be taken on that time. If suppose we are getting late, so maybe it will go for the wrong of the mothers. Maybe the mother is getting the complicated during the intranatal period. So we have to take it proper assessment on the time for the mother. And assessment of mother placenta and newborn is important after delivery of the baby. After delivery of the baby, we need to assess the mother abdomens, whether the placental separations will be occur proper and newborn baby care, we have to give immediate newborn care to the baby. That also it's important for take attention of the midwife. And enhance the newborn care after delivery of the baby. Immediate care should be taken like that, in that suctioning of the baby, cord clamping, cord cutting, that footprint taking, wiping, this and all are important care for that newborn care. So we have upgar score assessing, this and all we have to see as a midwife. And next, safe mother midwifery care. In safe midwifery care is established in public health facilities to provide perinatal and newborn care without any unnecessary interventions. As a midwife, we have to give care to the patients to provide perinatal care as well as to the newborn care without any unnecessary intervention. Unnecessarily, we should not take for that interventions like that, blood test and any radiological like USG, X-ray, MRI, like they should not take into the persons if suppose they are coming to that perinatal period to the hospital. And third one is respect the mother and their cultures. During the time antenatal period, most of the mother undergone the investigations and during the time of labor also. During the time of mother in the labor room for the delivery of the baby and postnatal period, the mother came for the follow-up. In these times, the health team members have to respect the mother and their cultures. Because of in this time, some as a midwife should not avoid the patients according to that basic of economical status, otherwise like relatives it's coming, like that we should not take any intentionally avoiding of the other persons. If suppose intentionally should not avoid for the mothers, those are having low economic status persons, like examples I'm telling. And next, see, health team members and nurse are all must to provide respective maternal care and ensure the woman's dignity during internatal period. Provide privacy, give confidentiality, freedom from harm, and postnatal period. Give choice of the family planning method. Also, also provide continuous support for promoting maternal and child health care. These all we have to maintain during the time of the giving care to the mothers. And next, promote self-determination. As a midwife need to take their own decisions during the time of patient's care. Sometimes the doctor's order can follow, sometimes they have to take only decisions because of the crucial times. We have to self own decisions here a midwife has to take because of some crucial time will be having, because sometimes that mother is having complicated cases. In that time, as a midwife they have to take a self decision, so that is important. In that time, as a midwife have the main confident level. The example of self-determination time is time of baby delivery, time of cord cutting and baby care, like etc. procedures will be available to take the self decisions by the midwife. And let's go for that educated practitioner. Educated practitioner means that is a midwifery another role to take off educated to the perinatal mother like woman center care. The midwifery is having it's another role. What it does means we have to educate it to the perinatal mother. So perinatal mother means that is already I told that antenatal, intranatal and postnatal. During this period we have to give woman centered care. Woman centered care means we have to focus only the antenatal, intranatal and postnatal mothers and how to maintain that health during the time of antenatal, intranatal and postnatal, that we have to explain for improving their health. And woman-centered care means midwife give health educations from pre-pregnancy to postnatal period. This is the topic care of parenthood, preconception care, antenatal care, intranatal care, postnatal care, newborn care, and family planning method guidance. These all the times the as a midwifery can able to educated to the mother for preventing the complications and to avoid the avoid and prevent that morbidity and mortality of mother as well as to the baby. At last one is that role of midwife. In obstetrical units, health team members are all responsible for while conduct the delivery and provide care to the mother as well as to the newborn baby. In obstetrical unit means that is health team members include that obstetrician, midwife, and a technician and pediatricians will be available in that health team members. They are responsible to take care of the mother as well as to the baby. Midwife provide care and promote health during the time of parenthood and preconception care, antenatal, intranatal, postnatal period. So here we saw already previously that previous topic, that is educated practitioner. We saw that here also will be available care of parenthood, preconception care, antenatal care, intranatal, postnatal, newborn, family planning method guidance. So for this educational practitioner and role of nurse, both it is having that same content of this. So only I gave here in explanation of for this of care. First one is that parenthood and preconception care. Preconception care provided by the midwife following care informed to the parents. If the parents is coming for the preconception care, some we educated, some education we have to give for the mother as well as to the baby, mother as well as to the father, because of we have to give healthy baby for, by them. So only we have to give some health education to them. So what and all means that is we have to give regarding that diet, smoking, alcohol, exercise, relaxation, pregnancy interval and all. We are seeing that diet in that do's and don'ts I gave here, and the as a mothers we have to give instruction to about that a balanced diet. They want to take proper balanced diet, green leafy vegetables, fruits, energy yielding foods, body building foods, and dietary process they can able to take it by the mother, but she has to avoid any chemical added foods and junk foods and all. They must to be avoid to giving that healthy baby. So above food items to be followed by the mothers as well as to the father also. And second one is using smoking. Smoking to be affect the fetus, so it should be avoided. If suppose the mother as well as to the father they are getting that smoking, if suppose the father is having smoking habit, that will be affected to the mother also, because of through that active and passive smoking will be present. So the mother also will be having the smoking effect. So if suppose the father is avoiding that smoking habit, mother cannot able to get the any problem. If suppose mother somebody's are getting mother is having some habit, that is like smoking alcohol habit means, if suppose they are planning for pregnancy, they must to be avoid this smoking. If suppose they are having this smoking habit means, some disease conditions will be available for occur for the baby as well as to the mother also. The baby is getting the premature labor, and the baby is having respiratory problem, asthma, allergy. These all will be having for the baby. And next go for the alcohol. Alcohol also will be having. They must be restricted alcohol. Both the parents, if they are having that habits, alcohol affect that ovulations, and they may experience medical problems such as miscarriage, IUGR, preterm labor, fetal alcohol syndrome, physical disability, and behavior problem. They are the baby is having. So they are facing this problem. And fourth one is exercise and relaxation is it is good for the health condition mother as well as to the fetus. And next, fifth one is the pregnancy interval. Pregnancy interval recommended that the time from delivery of one child to another child is at least 1.5 hours to 2 years. It's a need to give the gap between the one child to another child, at least 1.5 years to 2 years. And next, preparations. The mother and father has to prepare for getting the child or pregnancy. So some preparation need for the following. The mother or father has to prepare for child following that way, such physical preparation, psychological preparation, and financial preparation. Physically, they have to prepare for the healthy conditions of physically and mentally, and next they have to stable in the financially, then only they can able to bearing in the healthy child. And next we'll see that antenatal. In that antenatal, mother attend that antenatal clinic. In that times, midwife assists the mother and fetus in the community area or else in the clinical settle. They can able to assist. Some assessment they can able to do by that mother, midwife, that is ejaculation, physical examination, abdominal examination, identification of mother conditions, supervise and educate the mothers. According, if suppose we are doing this, you can able to identify the mother's conditions. According to the mother condition, we can able to educate to the mothers how and what they have to follow during the time of antenatal period. And let's go for that intranatal. In that intranatal, during intranatal period, midwife assure the comfort of the patients. During intranatal period, the midwife how to assure that comfortness of the patients, because of the during the time of delivery times they have more pain and they are not awareness about the process of the labor. So we have to give comfortness of the patients first. And taken place following assessment. Some assessment we have to do the intranatal period, that is history collection, physical examination, abdominal examination, maintain patograph, and conduct delivery. These are all the assessments we have to do. And next go for that postnatal period. Postnatal period, midwife initiated to postnatal mother start the breastfeeding after half an hour from the delivery, and I explain about technique and benefits of breastfeeding and prevent the complications during postnatal period. We can able to, if suppose we are explaining about the breastfeeding technique and benefits, the mother can able to initiate it for the breastfeeding, and that we can able to prevent for the complications in postnatal period. Thank you. All.